The starting point for any research should be the people that it applies to, me, the patient. So I'm a long-term patient with multiple chronic conditions. You know, I'm an intestinal transplant patient, I'm a cancer patient. I want to be part of research because truthfully, it's about finding a better treatment option or a cure for me. So it is personal from the word go. So why wouldn't it start with me? But you realise very quickly that as a patient, you have one thing that perhaps others don't always have. You have a real understanding of the problem you're solving because you live it and you breathe it every day. And if you can demonstrate that there is a need and you can demonstrate that you have a passion to try and solve that need, you can convince somebody to be stupid enough to give you a bit of money to develop a device. At the heart of it, it's not about going on to be a businessman, it's a real solution to a real problem that can help you and can help other patients. And it's your inbuilt passion and your drive that gets you through. Business comes later. You know, if it's successful, people will like it and it goes from there. But at the heart of it is, will this improve my life? And I would say, never give up. Because if you're an e-patient, you've coped with a long-term condition for a long period of time, you haven't given up on that regard. So use those values to develop something.
Michael was humble,
infinitely compassionate,
a leader and a mentor.
Someone who saw the best in people.
A quiet, understated giant of a man.
He was just incredible.
courageous,
brilliant.
Most insightful human beings that I've ever had the privilege to know.
Michael succeeded at everything he did, including creating an international startup to make life better for patients.
That without his help and without his encouragement, support, love and generosity, I wouldn't have stayed on course to develop what we call in this country the patient leadership movement.
He kind of took me under his wing and helped me learn the ropes of how things work behind the curtain at Medicine X.
His legacy, what he leaves behind, particularly in healthcare technology innovation, in patient safety, patient advocacy as a pioneer is considerable.
He gave me the confidence to find my voice as a patient leader. He spoke with such passion about what he wanted to do, and he encouraged everybody he touched, everybody that he met.
His message was simple: don't innovate for us, but with us.
I first met Michael at MedX in 2013, and I was so impressed with all the amazing e-patients. They were all shining so brightly, and the one shining the most of all was Michael.
He always had time for other people, even if he didn't have time, particularly if you were an e-patient who was looking for maybe a little help to figure out what your best service would be to the medical industrial complex that we're all trying to rehumanize.
You cannot create the environment of empathy and trust that healthcare requires without everyone included. These are the principles that will heal healthcare by driving connection across the continuum of care.
He's somebody who isn't afraid to show that he loves you, and he isn't afraid to tell you that every day. I knew that, he was in and out of hospital, and that he was sick, that he was managing a chronic condition. I don't think I knew how serious it was. And I was caught up in my own situation with COVID. I would get these text messages on my phone, and it would just be a bit emoji from him just because, just thinking of me, or just sending out a virtual hug, or like an elephant, a pink elephant, for no reason, just because. And my biggest guilt is I would be getting that while I'm in the ICU, and it puts a smile on my face I'm in the OR intubating, I get something from Michael, and I know he's thinking about me, and I'm thinking about him, and I didn't reply. And I don't think he was expecting me to, but that's my biggest regret.
You are an inspiration to me and countless others, especially many in the small intestine transplant community. Your legacy through not only 11 Health and patient-driven innovation will last generations to come. But your pure kindness, humbleness, desire to help will also last generations to come and speaks volumes. We will try our best to lead as well as you have and continue your vision of patient-driven innovation.
It was just a joy to be in his presence. The man leaves an incredible legacy behind.
I will always be thankful to him for being one of the few e-patients who's really changed things for a lot of us.
But Michael's loss is a huge loss for the world, and I'm not really sure I know how I feel about the fact that I'll never be able to talk to him again.
I'm sure if he was here, he'd say just carry on, but it's hard sometimes, and I really miss you, Michael. Lots of love.
We brought everybody together. We designed it, we co-created, we looked at it through everyone included, and then we delivered it through co-creation. And the truth is this, it's personal to me, but it's also personal to everybody else in the conversation. Personalized medicine is really about delivering a conversation, looking at the world through an everyone included model, and then you can deliver the outcomes. And if a bloke lying in a hospital bed in Oxford can end up on stage in Medicine X, together we can change the world.